importantly, you've got to balance your hormones. Hormones include your sleep, your stress hormones, and of course, eliminating any bad habits. So, hormones, that's progesterone, estrogen, testosterone, DHEA, and all the other hormones are all controlled by this little thing here at the base of your neck, your thyroid. You don't think much of it, but it was all controlled by your thyroid. And many of you come up to me in the last few days stating, oh, I have a thyroid disorder, right? And many of you have been to see, and I don't want to point to anyone, whoops, specialist after specialist, doctor after doctor. This is so common. I'm just looking around the room because I have treated some of you over the years in here. But you've been to see doctor after doctor with no relief. Number one, they're using blood. Number two, they're using inappropriate medications. So, I developed a system some 27 years ago called the Dr. T's core hormones. And this is what I do. So every time a patient comes into one of our clinics are trained to balance thyroid, the adrenals, sleep, and of course, we discover whether you have an underlying autoimmune condition or not. Now, thyroid is like the central railway station of all of your hormones. If it's not balanced, your life starts to deteriorate. And that's what you were complaining, and I'm not pointing to you, that's what you were complaining and you were complaining about, and you were complaining about, and you, right? Because you want to stop the deterioration. But no one has been able to help you. And of course, you start to put on, some of you start to put on weight and you don't like it. Now, we're going to talk about blood in a minute, but I did clinical trials over 3 years on 2,200 people. I discovered how to reverse Hashimoto's. That's sort of made me well known around the world. That's an autoimmune disorder, which at least 40% of you have in this room. I'm peer-reviewed, published, FDA, CE, TGA, FASI approved. I'm in 28 countries, and in February last year, we reached patient number 2 million. So we've done well in excess of 2 million patients now. So, who is at risk? According to Broder Barnes and Terry Hertog, they postulated in their books a few years ago, and they're the number 1 and number 2 thyroid experts in the world, that 80% of the population has a thyroid disorder. So what, there's about 100 people in this room, right? At least 80 of you have a thyroid disorder. And the blood tests are not valid. So, what does your thyroid do? Your thyroid is like the engine of a car, right? It makes your mitochondria produce energy. So thyroid is like petrol. The D3K2 that we use to make the engine work is like oil. And of course, the other thing you need in an engine of a car is water. Okay, and that is what we use the iodide for. I asked some of you victims, while I've been seeing you, right? Has your doctor ever asked you, any questions about your symptoms? No. This is so common. I'm an old doctor, right? We used to ask the patients questions. Tell me what's wrong with you, because the patient knows best, right? Correct? Yep, correct. But they don't. They say, okay, we will do a blood test. Well, this is what Sir Dr. Richard Bayliss, head of the Endocrinology Society in Europe, states about blood. He said that, and you've all had blood tests, right? But no one's asked you the symptoms. They say your TSH is blah, blah, your free T3 is this, your free T4 is this, even if they test that far, well, your T3 or T4 is this. They said, everything appears to be normal. But look what he says here, right? None That's NONE of any of the blood tests. TSH, T3, T4, free T3, free T4 are valid for determining thyroid function. And then he went on to say that the only thing that is valid, and this is the head of the Endocrinology Society, the only thing that is valid is the speed of the reflexes and the symptoms. So, what are the symptoms? You already know, because you told, I won't pick on you too many times, but a lot of you have already told me, you feel exhausted, you're tired, right? You're confused, you got hair loss, okay? And your brain is not functioning properly. It's sluggish. You forget things. Your mood changes. You can't control your weight. You're exercising. You're eating right, but the weight keeps on inching on and inching on because thyroid controls your weight. Okay? Well, that didn't come out very well. But you have the questionnaire in front of you, and here we are. Here are the symptoms of hypo, right? And you can see I've grouped them together. The green up here are to do with your brain. As soon as I shake someone's hand, I can tell straight away that they possibly have a thyroid condition because their hands, feet, and tip of the nose are cold. But this comes from a long list, but this is out of my endocrinologist handbook. If you score 8 or more, and you've all filled in papers around here, then you are by definition subclinical hypothyroid. Very few people are hyper. But we look for trembling, and I tested some people today to see if they've got a slight tremor, and it produces irregular heartbeats. Here it is here, and that's on your sheet. So what exactly is subclinical hypothyroid? That's where we park you because your blood tests appear to be normal, and of course you have the symptoms which the doctor hasn't asked you about, right? Subclinical hypothyroid means that you have the symptoms, your basal temperature is low, and that's why your hands are cold. Your resting metabolic rate is low, that means that you're putting on weight, and you have slightly normal bloods. In fact, all the bloods appear to be normal. And that's why it's impossible to pick up unless the TSH is extremely out. That's why it's very difficult to pick up a hypothyroid patient who is hypothyroid. Remember what Sir Dr. Richard Baylor said. Bloods are invalid, only symptoms and reflexes. There's a lot of risk. And a couple of you in here are cardiologists, right? There's a lot of risk if you don't treat your patient. This one here I was just talking to one of you in here the other day. He said, I've got fluid retention in my lower limbs. Well, that is what we used to call dropsy or congestive heart failure, because the thyroid affects the ability of the heart to pump. I won't go through every one of these. Diabetes risk. A lot of talk about diabetes. You're not going to get a diabetic patient right unless you repair the thyroid, because it controls the GLP-1 signaling pathways. Very simple. Get the signaling pathways, and what you do, what your doctor does to you, is going to be able to reverse pre-diabetic or early stage diabetes. Arthritis, inflammation, okay? What we call joint effusion, which is all your joints ache. And some of you have been telling me I've got aching joints and walking around like old people. I'm not looking at you. But it also increases the leaky gut, and it's called the cascade of autoimmune responses. And of course, Duprene's contracture, where the hand starts to curl. You get thickening of the skin on your hands, which I felt on some of you. But anxiety and depression. But listen to this, right? You double your chance of getting Alzheimer's, double it, if you don't correct your hypothyroidism. Simple as that. So all we say to a patient once we test them, and I've tested you, I ask them one simple question. Would you like us to halve your chance of getting Alzheimer's? Halve it. You would. Why don't you want to get Alzheimer's? You don't know. But you want to get Alzheimer's, don't you? So, and we simply get them to hold out a piece of paper and we can pick up the tremor. The tremor is a deterioration of the brain because we actually measure the speed of the neurotransmitters. And of course, I won't point out anyone who's pregnant here, but I found a couple of women who are pregnant in the audience, right? You better have your thyroid right. You better have the right amount of iodine, because iodine is going to raise the IQ of the baby, and the thyroid is going to make sure you do not have a miscarriage, and you can carry to full term. There's a whole lot of other problems, but I'm just going to pick on one of them: the psychiatric, depression, anxiety, schizophrenia, psychosis, bipolar orders, all triggered by low thyroid. So we have a very simple solution. It's a 4-minute test. And many of you have been tested on the ThyroFlex in metabalances. And in 4 minutes, we can decide with 98.5% accuracy. Here's the ThyroFlex test. That's my daughter. Hi. In a 4-minute test, we can determine the exact condition of your thyroid. In fact, we can get the dosage right, exactly right, on how much thyroid a patient needs. No more guessing. And you are going to feel really, really good. So up here we have neurotransmitter speed. Should be about 130 milliseconds. Her brain is starting to slow down. Here we have the reflex time. Should be between 50 and 100, no more than 120. This is borderline. The bigger the number, the slower the reflex. Instead of being like this, they're like this. Your whole body slows down. You get constipation. Your brain slows down. Everything slows down. And of course, not that any of you ladies here are worried about your weight because you're all slim and trim, but this patient, a hypothyroid patient, always burns 400 calories less per day, and it goes on between here, and you are nodding your head again. You're guilty. You're guilty. You're guilty. So, this patient only weighs 110 pounds. Right? Not your typical thyroid patient, right? But she has the symptoms. She also has problems with her breast, ovaries, and uterus, which we treat at the same time. So, what else can go wrong? Well, we've got straight hypothyroid. You can get Graves, Hashimoto's, hashitoxicosis, reverse T3, thyroid cancer. This is a Graves patient. Here's a famous actor, Marty Feldman. You can see the bulge in his eyes, right? And he died young, out from Graves. Here's another famous actress. I don't know what her name is, but these are the symptoms of Graves. Graves is not very common. The most common thing is Hashimoto's. But I want to tell you a fact. I've been treating patients here for 14 years, right? And we have found that the average worldwide for Hashimoto's autoimmune disease is 18%. I gave a talk like this to a group called the Ficky Woman in Bangalore just before COVID. And over 50% of them had autoimmune Hashimoto's. Quite amazing. But we'll show you some before and after photographs. So I've got 18% here, but in India it's a lot bigger. And I was the doctor who actually discovered how not only to reverse it, but cure Hashimoto's. When I reverse the Hashimoto's, your digestion clears up, your joints clear up. There's a whole lot of other things clear up. So if we don't stop the autoimmune response, this is what happens. You can have any one of these things. MS, MG, Guillain-Barré. Some of you have already come across some of these. But the disease shortens your life expectancy substantially, as well as the quality of your life. Now, we have another little twist to the story here called hashitoxicosis. If you have both Graves and Hashimoto's, right, you have hashitoxicosis. That triggers a DNA test. And so the DNA test is very specific. It's not who you are, but it's very, very, very specific. We get a results like this, where we're able to look at the inflammation, cellular, whether you have a wheat problem, a mold problem, We can tolerate fungi, where they've got a histamine problem, and we're able to do a RNA, DNA intervention, and it brings me tears to my eyes as a doctor for what we do for our patients. We're able to get them up walking out of chairs where they can't walk anymore, and I mean, amazing things. I'm still blown away by it. Stress is the other thing that can affect, right? But people don't know. They said, "Oh no, I'm not stressed," right? That's what you said to me. I'm not stressed, but they don't realize where stress can come from. Lifestyle, lack of exercise, diet, coffee. Oh, by the way, I drink 8 cups a day of coffee to keep myself going, right? It all impacts on your adrenals. If it impacts too much, it leads to something called reverse T3. And this is basically where the thyroid stops working. I've been called in as expert witness to people to doctors, especially in the United Arab Emirates, to where they've given the patient more T4, which has killed the patient because it's converting over into reverse T3. So a lot of you should be starting your day up here. This is what wakes you up naturally. A lot of you are starting it down here. We pick it up in the questionnaire that you will have on your seat, and many of you have filled out. So adrenals are a major cause of stopping the thyroid from functioning. And it can lead to other things, but when you look at the axes, this is the adrenal axis through here, and this is the thyroid axis from here. Stress inhibits. If it inhibits too much, you end up with reverse T3, and you are setting yourself up for an early death. So the treatment of reverse T3. So can we get reverse T3s in this test in this country, which is vitally essential? No, excepting for we've made arrangements with a lab here called Dr. Dang's Labs. And Dr. Dang is going to start the reverse T3 tests for the first time. These tests, now this is iodine deficiency. This guy here has got 2 Adam's apples. Really strange. You've never seen one with anyone, but I have seen some of you in here with 2 Adam's apples, right? The bottom one is the top one is the bottom is the thyroid. The top one is goiter from lack of iodine. Not only do we use iodine, we use D3 and K2 because it is essential. Finally, sleep, right? We have to get quality of sleep. Did you tell me that you can't sleep? No? Someone here, you did, right? Can't sleep. You can sleep, but your thyroid, you have a defunct thyroid, right? You scored more than 8 on that symptom sheet. You are, by definition, sleep. But sleep affects you in many different ways. So what do we use for sleep? We use magnesium, we use 5-HTP, we use tryptophan and serotonin. A lot of these things you can't get here, and I'm going to cover that in a few minutes. But this is what it does. To sleep, I've just written the book on sleep. To sleep, you have to have a cold room. You have to have a dark room. You can't have any artificial lighting. So there's many things that you can do to combat lack of sleep. So you have lack of sleep, do you? Okay, but it's fairly common. And this is what magnesium does. It relaxes the brain. It relaxes the body. But a lot of people here use magnesium citrate. It doesn't work. There are 7 different types of magnesium, and we combine 3 of them to get the right combination and the right quantities of magnesium together. I've just been commissioned to write 5 books. The two in final edit. The first 2 is Doctor, I Cannot Sleep, and Doctor, Why I'm So Stressed, and they'll be published throughout India in a few months. Now, this is Aruna from Nasik, right? This is about 14 years ago. And this is, I got the before and after photographs here, but she's telling her story about how she's been to see doctors in Europe, America, right? She's traveled everywhere trying to find an answer to why she feels so exhausted, so bad, and so irritable with her husband, right? She had heard it all before. I spoke to her in a 15-minute consult. She'd heard it all before, right? She was totally skeptical, right? I changed her life, and this is what we can do with all of you. I changed her life forever. All of her symptoms are gone. She's symptomatic free, and I'm going to walk around here in a few minutes and have a look at her symptoms. This is when I started with her. She's hiding behind her sister. She's trying to put a smile on. You can see it in her face. You can see the size of her arms. You can see the width of the hips, all because of thyroid. She had hashitoxicosis. That means she had both Graves and Hashimoto's. And this was her after year 1. Massive, massive change from here to here. Look at the smile on her face. She's starting to smile now. She's a lot more happier. And of course, a month after this, she decides to divorce her husband. Now she's going to feel really happy. Look at this. Year 2. This is at the end of the treatment. It takes us 1.5 years, 1.5 to 2 years to pull an autoimmune patient out. Right? Thyroid, 90 days. Straight thyroid, 90 days. But this is a massive, look at the smile on her face. She's happy because she has no husband now, right? But she's super, super happy because we've had such an impact on her life. And that's why she wrote that letter to me, how I've changed her life forever, right? This is Olivia, before and after. Here she's got, I'm so sick, and she got a big, and this is her today. Olivia, I've just highlighted a few. Terrible apnea, chronic headaches. You were just asking me about headaches. Non-existing sex drive, extremely weak, and lots of other horrible digestion, heavy irregular periods, suicidal. Today, she's 25 kilograms lighter, and I highlighted the thriving sex life. But she is so happy and so motivated like she's never ever been before. So these are the impacts we have on people's lives. These are very famous doctors in America, and what ThyroFlex does is we identify, we treat, we dose, we titrate until you have optimal health. So this is a lady from the Philippines, Jenny. She's actually originally from Pune. And there she says she's a terrible pill taker, but I made an incredible difference to the quality of her life. This one here, Dr. Nomi is one of my staff doctors, like Dr. Rash is over here. Hi, Dr. Rash. I said I'd leave you alone. But we've got the GI system sorted out, the now stronger, more energy, and a high quality of life. We're a mini pharma. We make 60 hormones. We do hormones only. They're all natural, bioidentical. We've just set up our own pharmacy in New Delhi. But our medications are star performers. You can't get anything like our medications in India. I'll tell you why, right? Our D3K2 is not synthetic. It's derived from the wool of New Zealand sheep. It's natural. You just can't buy natural bioidentical D3 in India, right? And the K2 in the form of NK7, NK4 is derived from natto. We import it from Japan, where they ferment it underground for a couple of months, right? And I've developed a way, and this is with all my medications, how to uptake the D3 by 380% better than anything else in the world on the market. And this goes for just one example. Our thyroid has T1, T2, T3, T4, and T7 in. In India, you can only buy synthetic T4. Or what they call compounded, which is synthetic, again, T3 and T4. It doesn't work. And patient after patient that I've been talking here today said that their medications don't work. But we put our tyrosine, our aspartic acid, selenium, we have no binders, no fillers, so you can't have allergic reactions to them. Well, 80% of you are autoimmune in this room. Have a thyroid disorder. It's more than 30% are autoimmune. I've shown you the answer. Now it's a call to action. I'm going to quickly walk around the room, and I know how to get a baby genius too. And I've already told a couple of the girls here who are pregnant exactly what to do. But I'm going to have a look here. Your name is Vishesh. This is Vishesh. I've only just met him a few minutes ago. And his score, he's filled this out for me nicely. His hypo score is 12. That means that by definition, he is subclinical hypothyroid. He needs our help. He doesn't appear to be autoimmune because his hyper score is 0. So with this sort of patient, this would be straight 90-day of testing and titrating to get him right. Okay? Your one? Whoa. You look the picture of health. Your symptoms are 30. But you have palpitations, tachycardia. That means that not only are you hypo, you're hyper, and I think that you have an autoimmune disorder that we will do the blood test for. The blood tests are TPO, AB, TGAB. Very simple. Okay, you need help. You need our help. Oh, wow. Oh, so you haven't slept either. So this patient's symptoms are about 18, definitely subclinical hypothyroid, which we can prove. Next one. Your score is 12. You're more than 8. That means that you have a thyroid problem. You should be screened and tested. Oh, you didn't fill it out. Who else filled them out? Okay. This victim here, his score is 4. That means that he doesn't have a thyroid problem. So if I test him, his thyroid will be normal. Muscle, joint pain. I don't think you have a thyroid disorder. No. She's got 26 here, and she is definitely subclinical hypothyroid. You should be tested. Okay, listen, my time is up. I have to conclude this presentation, but thank you very, very much. I know how to raise the IQ of unborn children, and we'll talk after this. If you want to ask me questions, I will tell you exactly how we do that by 10 to 12 basis points. IQ from 110 to 122, if you want that sort of thing. Thank you very much.
Thank you so much, Dr. Turner.